So we just had a terrific session on PNH. And the great news for patients is that there are a lot of options. Now, we, for many, many years, had only one option of anti-C5 inhibition, which we call terminal inhibition. So remember, the complement is what destroys the red cells in PNH. And you have terminal proteins and you have proximal proteins. And you have inhibitors for the terminal proteins and now for the proximal proteins. So these are improvements and added a lot of options. So now we have 4-5 different drugs or therapeutic options for patients with PNH that you can either use as frontline, or you can apply for patients who are on a C5 inhibition or a terminal complement inhibition, but don't have a great response. And you have options now that you can come with to help improve the hemoglobin and symptoms in those patients who are on a terminal complement inhibitor and still have a hemoglobin that's not normal or still having a couple of symptoms. So all panelists agreed that this is a great time for patients because for the first time we have a number of options that we can choose from to give patients to better improve their quality of life, their hemoglobin, and have them go back to normal. So we have now a lot of options to choose from to treat patients with PNH. Historically, we had C5 inhibitors, which are terminal complement inhibitors, and we have new of these agents coming along, but we also have proximal complement inhibitors. The efficacy is very similar. There are some differences in terms of how well they control the degree of anemia, but the mode of administration they're different. And I think patients will play a vital role in helping the physician help them to choose the best therapy. For example, there are agents that are intravenous every 2 weeks. There are agents that are intravenous every 8 weeks. There are agents that are subcutaneous twice a week. There are agents that are oral. There are regimens that combine an IV administration with an oral drug. So this preference will be very, very important that the patients do communicate to their physician so the best choice can be made by the patient with the help of the physician. We have come a long way, but there's still room to improve. There are still issues regarding breakthrough hemolysis, meaning that there are periods where the patient might experience a drop in their hemoglobin, more of a hemolysis. We still have not cured the disease. In our panel we just had, this was the question I posed to the panel, and I said, so what is that we're lacking today? And yes, we have come a long way. We can control this disease for much longer, much more conveniently for patients, but we still have not cured the disease. So I think the frontier long-term would be to find therapies that eventually reach that desired cure.